the thing that is required is general awareness about snake bite, to identify and differentiate between poisonous and non-poisonous snakes, to do a bit about the first aid, what we all can do to the patient before the medical treatment is started, and when the patient reaches the hospitals, the treatment is very simple. That is the anti-venom to be given by the concerned medical officer. But before that, many factors come into play for the patient of snake bite. And one more thing, I would request the representative from Apollo to also prevent snake bite. How to prevent snake bite? There are certain issues that we can take care also. Where we stay and where you work, simple steps can be taken so that we can make the area snake free, or even though there are snakes, we can keep ourselves away from their habitation or routes of travel so that we do not get accidentally bitten by any snake. I thank all of you to be present here on this first initiative on health awareness, and I also thank the Apollo Hospital Group to have taken such an initiative to educate all the interested persons about snake bite. Now I request the Apollo Hospital person to start the awareness program.
Very good afternoon, ladies and gentlemen. A warm welcome to all the NTPC staff and senior members of NTPC group. And it's our pleasure to have you all for this health awareness talk. This we are continuing for the last 6 months. We have done 6 sessions for the NTPC Bongaigaon, and the today's speaker is Mrs. Salma Thomas. She is our head clinical nursing education here, and she is having 16 years of experience in clinical education. She finished her BSc nursing, MA psychology, MSc nursing, certificate in essential palliative care, trainers and training program in HIV, and she is also having a certificate in clinical counseling, and now she is undergoing her PhD, and she is taking care of most of our health awareness talks for various corporates, and we also do major programs for the major continuous nursing education program for so many medical colleges, and it's our privilege to be all the NTPC staff attending for this program. Over to Mr. Salma Thomas.
Good afternoon, ladies and gentlemen, and my dear friends. I hope I'm audible at the other end. And I will complete my presentation. And if there's any doubt regarding the presentation, you can ask me at the end of it. Fine. And today's topic is something rare to us because we're all from the city. But most of us have actually experienced it at some part of our life, wherever we've gone. And a general awareness is very essential because some general awareness actually helps us a lot of prevention of a lot of complication. And when we are aware, what happens is there's a lot of lesser agitation in our minds. We have the mind that is patient and it is stable, and it thinks stable, and we are able to take the action at the right moment. So that's the reason we need to create a awareness of a common problem. So when we're talking about snake bites, so snake bites as such, actually speaking, it's a form of injury. An organism has come and bitten a person, and the organism is a snake. So the bite can be from a snake which is poisonous or non-poisonous. But generally, if from our understanding, when we are thinking about a bite, a snake bite, the first thing that comes to our mind is a two-fang mark. That's what generally we have an idea about snake bites. So, next slide. When does it happen? We normally have the idea snakes are all very dangerous, right? So snakes are dangerous, that is there, but I think we are more dangerous than them. They keep to their own habitat. But what happens is, when do they bite? Only when they are scared of something. When they feel that we have gone into their space and we may cause them some danger. So they get scared that they are at danger because of this person or this human being who is coming into their area. Actually, what we do is we are scared of the snake and we start disturbing them. But what happens is, on the other end, they are scared of us, and because they are scared of us, they feel that we'll harm them. They take the defensive mode. At that point, they come and bite us. And of course, it cannot be generalized. First thing is, we should be getting into their habitat and disturbing their routines. But there are certain snakes, when we are staying in their habitat, even when it is silent, they come. When they see that it is an intruder in their habitat, they attack them. That is a very, very rare phenomena. Majority, let me tell you, 90% and above, it is because the snakes feel that they have been disturbed by a foreign organism, that is a human being. So what do we have to know about the snakes is, snakes are actually a cold-blooded organism. Cold-blooded in the sense, human beings are warm-blooded. That means our body temperature is stable, like 37 degrees or 98.98 degrees Fahrenheit. So body temperature is stable. So when it is very hot outside, what happens is we sweat and our body temperature is regulated. When it is very cold outside, we start shivering and then our body temperature is regulated. But what happens in the snakes is, they're all cold-blooded. So their body temperature cannot be regulated according to the environment. So what they do is, they go hide at places where it is cold and wet and where it is dark, where where their body temperature will accommodate to that particular temperature. So what happens is, generally when it is wet, when it is a lot of dry leaves or wet leaves, some kind of vegetation where it is moist and wet and it is dark, those areas they will go and hide. Even in houses, if you see, if the tiled roofs are there, within the tiled roofs they will go and hide. And if there are tubes and pipes and places where it is dark and cold and where it can slip inside, those are places where they will go hide. There are places like under the bed, corner of the house, behind the cupboard, inside a tube, these inside a pot, mud pot. These areas they have actually found snakes which have strayed from outside and have come inside. So they are actually looking for a place which is cold, which is moist, where their body temperature can accommodate itself. Next thing is the timing. They don't generally come out in the mornings. So mornings are, it may be very hot. They cannot accommodate themselves to the warm temperature. So what they do is, they come out in the night times. So most of the snake bites, if you see, it will be related to going barefoot in a shrubby or in a vegetation filled place, or when it is a moist environment where there is a lot of plants around, where it is rainy, and sometimes in the night time when they go into the forest. So these are the times where it comes, or when it is very hot outside and when they are staying indoors, and because of the heat outside, the snake has strayed itself into the house of a person. So these are times where you can find. The reason is, they are cold-blooded. Okay. And if you see the types of snakes, there are actually 3,000 plus species in the whole of the world. In India alone, we have around 600 species or different types of snakes. But broadly, if you see, you can classify the snakes as the snakes like cobras, where they actually, when they bite, they will hit the neuro system or the neuro brain and the nerves of the person. That is one type of snake. Next is, there are we have these vipers, right? Vipers are very common in Guwahati, Assam, and the northeast side, and cobras are more common in the southern and the western Ghats. That area, the cobras are more common. But around 600 odd snakes, types of snakes are there in India. That in that, if you see, the poisonous snakes are very few. Only around 10 percentage of the snakes that are there are considered poisonous. On the whole, or almost like 70 percentage of the snakes are non-poisonous. And even in that 70 percentage of the snakes, only 50% when they bite, even if the snake bites, only 50 percentage chances that the snake has given its venom to the person. So when a person is bitten by a snake, we must consider these. Fine. So when we're talking about the types of snakes, I told you the first one is the one which like cobras, which attacks the brain and the nervous system. Then the second type is which attacks the blood and blood vessels. Then the third type is those which attack the muscular system. So the snakes like cobra which are attacking the nervous system can also on the extension attack the muscular system, because the nerves will be supplied to the muscles. So you will find symptoms of it in the muscles also. And which are the in India, if you see, cobras are quite common, especially in the Western Ghats, and vipers are more common in the northeastern portion. And even in cobras, you have, how do we recognize? Actually, they have a small head, round cylindrical body. But if you see vipers, they will have a larger head. And cobras, it will have a definite kind of a hood. And in that hood, you will find two eyes and one U-shaped connection. Sometimes there are single eye also in rare kind of cobras. That is how we recognize them. Then how is the venom released? So usually the snakes, they will have two teeth. Okay, let's say they have two teeth, and if you see cobras, these are nice and sharp in front, and there are smaller teeth at the back. If you see the vipers, they'll have two long teeth in front, but they may not have any other teeth behind, smaller teeth behind it. And if you see the teeth, it won't be like us, it will have a centrotubular structure, and this is connected to the place where the venom or the poison is collected. So if this is the face of the snake, the eye is here. Behind the eye there will be a sac. In this sac you will have the poison collected. And from when it has the instinct to bite, what it does is the sac is compressed. When it is compressed, the poison travels from the sac to from inside the teeth. And when the teeth plants itself on the person, through the teeth the poison will be released into the person. Now when the release of the poison also depends upon whether the snake wants to just hurt and scare the person or to hurt severely. Okay, when it is just biting, 50% of the time the snake does not release the poison, but the other 50% we have to be cautious about. When it may release a poison, it compresses the sac. From the sac the poison comes to the teeth, and through the teeth it is just like how we give an injection. Through the teeth it is injected into the person's body. And as I told you, apart from these, there are other snakes like water snakes. And most water snakes are not poisonous, but there are sea snakes which are around 20% of it, which may be coming into the river and coming into the land. They are a little poisonous, and they cause it may not directly hit the neurological system, but it causes muscle symptoms, like they'll have weakness of the body, weakness of the muscles, they'll have twitching, they'll have fits like symptoms in them. Okay, next thing is we need to know about the poison that is released by the snake. Only then we will understand what kind of changes it is bringing about in the person. So usually the snake poison, as I told you, only around 30 percentage is poisonous. Even in that 30 percentage, when it bites, only 50 percentage chance of releasing the poison is there, but we cannot take chances. So let's see how the poison is going to act. The poison actually has a lot of enzymes. They say that around 25 different types of enzymes are there, and each enzyme will act differently on different parts of our body. And even in this, if you see, there are proteins and enzymes. And how does it act? These enzymes actually have certain, like one type of enzyme is a proteolytic enzyme. What is this proteolytic enzyme? Proteolytic is it dissolves the proteins. If you see some of the people with snake bite, you will find around the area of bite, you will find one kind of dark discoloration. Right? It is because the tissue around the bite has actually started dissolving. That is, the protein around has started dissolving. This is proteolytic. Next thing is something called phospholipases. So here what happens is, we know that there are muscle tissue, there are fat tissues. Here the fat is being dissolved. Next thing is something called hyaluronidase. So this hyaluronidase is a very common enzyme, and what it does is it helps in the poison being taken up by the body and the fast action of it. So these are there are different types of enzymes, but how it generally acts is in different portions by the type of enzyme it is having. So let's say we can categorize these poisons. One thing is cytotoxins. So cytotoxins is, cyto means some kind of tissue. So this poison will cause damage to the tissue. Next thing is hematotoxins. That means it will cause, as I told you, neurological. One is hematological, then neuro can also extend on to the muscle structure. So what happens is, this hematotoxins will actually go into the blood vessels and it will cause changes within the blood vessel. So how does it cause changes? It will actually enhance the clotting mechanism. So clotting occurs within the blood vessels. So that will lead on to problems and the death of the person, lysis of the tissue, that is death of the tissue within the blood vessels. Next thing is the neurotoxins. As I told you, the common forms like cobra, they actually release a neurotoxin. That means these poisons go and attack the nervous system, the nerves and the brain. So, okay, the nervous system of the person. Next thing is cardiotoxin. So cardiotoxin is, it will go and cause a cardiac arrest. So it directly attacks the cardiac muscles or the muscles of the heart. So the some signs and symptoms, if you see, first thing is when a snake has bitten. Okay. First of all, let's see externally. Externally, you will find the teeth mark. Okay. So you will find two fangs nicely deeply embedded teeth mark. And the person may say, I'm having severe pain around the area of bite. And next thing is, you will find swelling where the snake has bitten, and the area, the color is changing. As I told you, initially it may be red color. Then as the tissue around is being dissolved, that is necrosis, that is death of the tissue around the bite happens, and it becomes black in color. And then if you see from the bite area where it is bitten, you will find fluids like watery substance that is coming out of it. Okay, blood is red color. Some from the blood only the cells are separated and the watery the plasma alone. So you will find yellowish discharge coming out of it. Then you will find uh, the other symptoms internally. One thing is, you will find they are feeling very dizzy and they're fainting. Next thing is, they will say that I'm feeling very thirsty, I want to drink water. So one thing is, they become very anxious when a snake bites. Okay. And we are already conscious a snake has bitten, a snake is very poisonous. Because of the poison, there is a high chance of me dying. So that itself will be causing a lot of symptoms in them. Apart from the psychological symptoms, the physical symptoms will also be present. So we cannot discount it completely. So what are the physical symptoms? They will have kind of dizziness, they'll have fainting spell, they'll feel thirsty, they'll have severe headache, especially with neurotoxins. When the snake is a neurotoxic agent, at that time severe headache is the sign. Next thing is severe headache and visual disturbances they will have. So when they are seeing, they will not be able to see a particle properly. There will be a lot of blurring of vision. Then what happens is, as I told you, they'll have severe pain at the site of injury, and because of the metabolic changes, they may develop fever. And as I told you, next thing is myo. Myo means muscle. So the nerves can also cause the changes in the muscle. So when it is attacking the muscles, you know the whole body has a lot of muscles, and especially the muscles related to the chest. Chest, the respiratory muscles, when they are involved, what happens is they have a difficulty breathing. The respiratory muscles may become paralyzed because the nerves are being affected. The nerves that are supplying the chest muscles and the body muscles are being paralyzed. So what happens is they will not be able to breathe properly. That means expansion of chest does not occur. So they have difficulty breathing. Then what happens is the wound. So the fang mark, they may have bleeding, they may have burning sensation, the color changes, and uh, when the nerves are involved, there are several other symptoms. They will have kind of funny sensation. They'll have one kind of tingling sensation. They'll have the cold, chill feeling. They may be sweating terribly, and they may have severe, if it is a snake which is causing a hematological change, or when it is related to the blood supply or the blood or the clotting factor of the person, you will find blackish blue discoloration not only at the site of bite but also in different parts of the body. You will find blackish blue discoloration. Then heart, what will happen is they will have a rapid heart rate. Okay, uh, they will feel palpitation, they will have an increased heart rate, and their blood pressure will drop. When the blood pressure drops and when the heart rate is rapid and the pulse is feeble and is not able to be felt, they go into shock. That means the blood pressure drops to a very low level. Then in the muscles, they will have convulsions like in the symptoms. It will be like fits they will go into. It's not
Hello.
they will have kind of fits like symptom. It's not only a regular fits like symptom. They will be squirming and turning, and because they'll have severe muscle pain and muscle problem. At that time, what happens? It won't look like a regular fits like thing. Fits like action may also be seen, but apart from that, they'll have a lot of twitching of the muscles. They'll be turning themselves up and back and forward because the muscles will be going into a twitching feeling. The next thing is they will not be able to coordinate activities. Suppose I want to carry a book, they will not be able to focus and take it up. Next thing is they'll have severe muscle weakness. They will not be even able to take the next step forward or move their hands or legs, and slowly it can progress on to paralysis. That means the functioning of the limbs will also be cut off. It will be slowly progressing into paralysis. Next thing is they may have nausea, vomiting, like vomiting feeling, and they will have vomiting. They'll have diarrhea also. These are some of the symptoms that we need to see, and especially we need to be conscious about headache, visual changes, respiratory changes, and the wound around the bite. Okay, visual changes, if you see, it is like if you see their eyes, you will find that the eyes are rolling upwards. Okay, and they will look very, very sleepy, drowsy, because the toxins or the venom is taking its action. So slowly they'll feel, I'm feeling sleepy, I'm feeling thirsty, I'm feeling sleepy, I'm feeling drowsy, and they may sink, and the eyes may be up rolling. Next thing is they will have, like if you see, slowly you will find their eyes are not moving. Okay, the black eyeballs, it will be stand still and it will be uprolled and it will not be moving. That means paralysis of the ophthalmic muscles or the muscles supplying the eyes are also captured by the neurotoxins. And then you may find death finally. Okay, next thing is when it is the vipers, we must also see the bite marks may not be typically two fangs. Okay, it may be the space may be larger, and non-poisonous snakes, when they have a bite, you may not find just two fangs alone. You will find a series of teeth planted on the person's skin. And apart from it, as I told you, at the place of bite, you may find blisters. That means water-filled vesicles will be seen. Next thing is when the coagulation mechanism or the clotting mechanism of the person is lost. I told you some toxins affect the nerves, some toxins affect the blood vessels. So when it is affecting the blood, the clotting mechanism is affected. So at that time, as I told you, you will find a blackish blue discoloration not only at the point of bite but also in several other parts of the body. And what happens is their bleeding is altered. Okay, so that means inside the blood vessels there is a clotting and there is a bleeding. Okay, so if you see from the gums they will start bleeding, from the nose they may start bleeding, and when they pass urine you may find blood in urine. And in the kidney, if it starts bleeding, they may go into renal failure also. These are certain stages later. So what do we ask them? We have to ask them if the person is, if we have to find out if there is pain, if there is fang marks, and what are the symptoms, whether it is related to the nerves or related to the bloods, and how are they manifested, like whether they're having a fainting, whether they're asking for water, whether they're having nausea, vomiting, if there is palpitation, there's difficulty breathing, if they have difficulty moving their limbs. So when you look at them thoroughly. Fine, and quickly, because we need to take a quick action.
Doctor, can you make your presentation full screen?
Full screen. Is it okay? Is this okay now?
I think all projects can see.
Is it full screen now
Madam,
for
go
you?
to slideshow.
हम लोग दिख रहे हैं हाय
Are you able to see it full screen now? Hello?
Now presentation is replaced with video, ma'am. Earlier it was better. Earlier only presentation was there.
1 moment.
इससे पहले चल रहा था कहाँ का इशू मुझे हाँ ये वाला
Okay now. As earlier, this is still okay, ma'am. Okay, this is visible.
अरे वो पहले वाला
Is this okay now? Fine?
Fine, fine.
Okay, can we continue?
Yes.
Okay, let's see who are the people who will be affected maximum. Okay, a snake bite to me, a snake bite to brother, a snake bite to you. So who is going to be affected maximum by the poison? Fine. One thing is body weight. If the person is nice and muscular and heavy, the amount of poison given may not have a rapid effect. Next thing is the age of the person. A younger person, they will have greater effect than a older person. Fine. Next thing is if there is a factor like which part of the body the bite has taken place. If it is in the hand, if it is in the leg, That means the traveling of the venom may take some time. At the same time, if it has bitten me on my chest or on my face, at that time the venom travels faster. Next thing is, when I've been bitten, if I'm really running up and down and getting agitated, and when I'm working out, at that time what happens is the blood supply increases, that carries the venom faster throughout the body. At the same time, when I've been bitten and when I'm resting, the blood travels slowly throughout the body. So the time of action of the venom or the poison also takes longer. Next thing is individual sensitivity, because each of us have a capacity to take the poison. Some people, if you see, they'll be you would have seen videos where they've been bitten by so many snakes, but nothing will happen to them. Okay, so those are rare phenomena. Let's not take that into consideration. But there are people who have a certain level of sensitivity, or they are able to take up a certain level of poison. That means that doesn't affect them readily. But for certain people, even a low level of a bitten poison, it actually takes a severe effect. So it depends on the individual character.
Can you change the slides, ma'am?
Let's go ahead.
The slide is fixed at local effects of snake bite.
Okay, fine. So I think I already told about the bleeding.
Yes, you have covered all these
About the
things.
neurotoxins too.
Diagnosis. Okay, you can start the diagnosis.
Thank you very much. So when we are talking about the diagnosis, we need to know how we assess first when they are brought in. So what we have to do is make sure we know what time the person was bitten, because at that time we know how long it has taken. Next thing is whether the person is active or not. The next thing is whether any kind of first aid has been given. Okay. Now let's see. Uh, what we need to know in mind is, we don't have to have a very specific idea about a first aid. What we usually think is, when there is a snake bite, how do we do? We saw how to diagnose it. That means what kind of snake, what kind of bite. We also saw what are the kind of effects they can have on the body. Okay, so what do we do for the first aid? First thing is, you have to not get disturbed about anything. There is something called right that you have to remember. RIGHT. Just remember right. R means all you have to do is make sure the person is not getting agitated, because they'll get scared. I've been bitten by a snake. Reassure them. Make sure they are calm in their mind and they are not too active. Their heart, they shouldn't get palpitation and they shouldn't get tensed. So reassure them. Tell them that you're there and you'll be taking them to emergency. You've called for the ambulance and people are coming. Keep them in one place. Don't allow them to move around. Okay, eye is immobilized. That means just like how in fracture, what do? We ask them not to move the limb or move the affected area, right? The same way, in a bite, ask them not to move their affected limb. Okay, when they are moving, what happens is the poison travels faster. So make sure you're not allowing them to move. The third thing is GH, that means go to hospital. We know that only 30% of the snakes are poisonous. We know that only 50% of percentage of the time the snake is going to release the poison, but do not take chances. Immediately, as soon as you recognize it is a snake that has bitten, don't try to identify which snake has bitten. Okay, don't run behind identifying the snake. Just transfer the person to the nearest health center. Okay, earlier what they used to do is tie a cord over the area of bite, right? What they say is, if you tie a cord over the area of bite, the poison will not travel. But actually speaking, it does not have any much effect. So you need not tie, because sometimes when you tie, the poison stagnates, it causes necrosis too much. Okay, so don't tie, don't waste your time, reassure the patient, person, ask them to lie down, not to move around, and make sure you call an ambulance and make sure the person is being transported to the unit. Okay, next thing what we do is, traditionally we make a cut where the snake has bitten, and we try to pump out the blood. Or on the worst case scenario, what we do is we keep our mouth, we suck out the blood and spit it out. I think all of us have seen it in movies. Please don't try it. Okay, so what we do is, when we are cutting and when we are pumping the blood out, it actually gets pumped to the other side. Next thing is, when you are sucking it, if you have any oral ulcers or anything, it is going to cause, the venom is going to reach you. Your safety is important for you to take them to safety. So don't try any of this. Fine. And next thing is, uh, you don't have to waste your time. If you know which snake has bitten, it is well and good, you can tell it to the doctor. If you don't know, don't worry about it, because the anti venom that is being used is actually made to make sure it is having an action against many of the snake poisons. So don't worry. If you know the snake, a particular snake anti venom can be given, it is fine. But if you don't know, please don't worry about it. Same slide only. Okay, please don't worry about it. And when a person has been bitten, whether it is poisonous or non-poisonous, when there is an injury, make sure in the health sector a tetanus toxoid is given to the person, because it may be a non-poisonous bite. At the same time, the person may be affected by tetanus. Just to avoid that, make sure a tetanus toxoid is given. Fine. So what do? Make sure they are reassured safely, and next thing is immobilized, safely transferred to a facility, and then you tell the doctor about, if you know the snake, fine. If you don't know, don't worry. Okay. And the symptoms that you have, the person has been having when you were transferring the person, you make sure you are observing and telling. And then if there is anything constricting, like for example, we tie these threads in our leg, in our hands, it may be a thick ring, all these, what happens is, if possible, if there is a bite, you remove these constrictive jewelry, because as I told you, edema will occur. That means swelling of the tissue will occur. If there is a jewelry there, it will constrict the blood supply. Okay, and it will cause tissue necrosis. So if there's anything that is constricting, please remove it. Okay, and then immobilization is must, because as you move, it increases the blood supply, it makes the venom travel faster. Okay, so what all we shouldn't do? Do not cut, do not suck, as we have seen in our childhood. Fine. And next thing is, tying a thread or cloth beyond the area of bite actually doesn't help. So don't waste your time on it. Don't use electric shock or ice or anything, because it will cause freezing of the area. It will cause burns in the area. And sometimes we use these alcohol rubs to clean the area. Don't do any of that, because what happens is, this alcohol rub, it will actually reduce the pain sensation, but at the same time the absorption of the venom gets faster. Okay, so these are things that we must remember. As common people, we don't do it. Fine. So how do they treat at the medical level? First thing is, they will make sure if the snake is identified, a specific antivenom can be given. Otherwise, give them a general antivenom which attacks every other enzyme of the of the snake venom. Next thing is, symptom wise, if they have problem with breathing, they will make sure that is attended. If there is a lot of bleeding and wound from the area, they will make sure that is cleaned and addressed. We also, I forgot to tell you, if there is an external injury because of the snake bite, because there could have been a struggle, okay, where that fangs could have torn the skin, and there is severe bleeding. It may not have a poison at all, but the fangs have torn and it has cut a blood vessel and severe bleeding is there. At that time, what we have to do is make sure you are covering the area nicely and bringing them. Fine. And if the person is asking for something, they may say, I'm feeling thirsty, give me something to drink. At the time, as far as possible, don't give them anything orally, because as I told you, it may affect the breathing muscles. So when they are trying to breathe itself, it is going to be difficult. When you are giving them anything orally, it will go obstruct their breathing area. That means their air pipe may be obstructed, the fluid may get into their air pipe and they may aspirate. So as far as possible, don't give them anything orally. Just a little about what we do and what we don't. What do we do? First thing is reassure them, right? Okay, keep them calm. Tell them that you're there. Tell them help is on the way. Next thing is immobilize them. Okay, make sure they are not moving back and forth. That area where it is bitten, you make sure it is being dressed and it is kept in a position where it is not moving. Next thing is, if there is any wound or something, an open wound, wash it off. Don't use alcohol rub because it will increase the absorption of the venom. And call for emergency before that. Make sure whether it is poisonous snake, non-poisonous snake, don't worry about it. Make sure you are transferring them to a medical center. Don't, if you know the snake, tell them. If you don't know the snake, don't bother. They'll give an antivenom that will support all the snake bites. Okay. What you shouldn't do, don't take the patient to, actually there are some very good remedies that the tribals have, but most of us do not know. Okay. When you don't know, don't try it. And when you don't know, don't even transfer them to those units. Okay. Next thing is cutting the wound, sucking the blood with your mouth. Don't do that. Okay. Tying, it doesn't help. Burning, keeping ice, don't do it because it's going to cause frostbite and burns. Fine. So these are things don't try when you don't know. Fine. So there are experts to take care of it and they will do it. Fine. If there are any doubts, you can ask me now.
बोले बोले Hello, madam. What?
Yes.
What for the H stands for? You said in the beginning. Right, RIGHT. What for the H stands?